Good evening, and welcome to When, Where, and How Community Immunity. This is a series of regional discussions that we're having here on blackdoctor.org, where we're going to take the national conversation regarding COVID and the vaccines down to the local levels, particularly areas where a number of Black and Brown Americans live, reside, and we're going to really see if the rollout from the national level is working at local levels and how it's working. So we have done, last week we did Washington, D.C., and we had some interesting results there, and we had Walgreens come on and talk about their partnerships. And then last night we did the Dirty South. We had Atlanta, Charlotte, and Birmingham on. And so there was some definite lags in terms of the South with regards to vaccine access and acceptance in the South among Black Americans. And so tonight we're going out west. We're traveling out west, and we're going to talk about California. California, where specifically SoCal and NoCal. So I know there's some clashes sometimes between the Southern California and Northern California folks, but we're all going to be friends tonight because we're all talking about getting vaccinated, and we're going to really talk to two groups and some national experts. We also have some local officials, and we've got some national organizations on. So we've got a good cross-section, including local citizens. And so we've got a good cross-section of people that we're going to bring on and have a robust vaccine discussion. So I've got a couple of instructions for you before we get started. One, if you're watching us tonight, let us know, drop us where you're watching us from in the comment section. We always like to know where people are watching us from all over the globe, because we know we've reached people as far as England and South Africa. So we'd like for you to drop a note in where you're watching us from. And if you have a question throughout tonight's broadcast, please drop it in the comment section, and we will try to get to it. If not during the broadcast, we'll try to get to it at the end of the broadcast when we have our panel discussion. So I know you didn't get on to hear me talk. So we're going to bring on our first guest. First up, we've got Dr. Melissa Clark. She is first of all, she's a host of Excuse Me, Doctor on Black Doctor every Monday night at 9 p.m. Eastern Time. So check her out. It's a wonderful, wonderful program. But she's also a member of the Black Coalition Against COVID, and that is an association that has been of Black associations and individuals that are dedicated to making sure that all of the information, all of the data, all of everything surrounding COVID is effective and legit, and getting that information to Black Americans and translating it for Black Americans. So welcome, Dr. Clark. I can go on with your credentials because you're so educated.
Thanks for having me, Alice. I appreciate it. I'm glad to be here.
Thank you for joining. And we also have Dr. Oliver Brooks, who is out of the great state of California. He's no stranger to Black Doctor. He has been on many times with Dr. Lenore and I on our programming, and he's also been on the Making It Plain programs. And he's just a wonderful, wonderful contributor with regards to COVID. Because last I checked, Dr. Brooks, you're still sitting on the panel in terms of distribution there in the state of California.
Yes, the ACIP, the California Drafting Guidelines and the ACIP COVID-19 vaccine work group.
So if you have a question about how the vaccine is supposed to be distributed in California, we've got the man right here on the show with us. So let's start with the questions about the CDC and their guidelines. And so there's been a lot of people been angry at the CDC about having these mask mandates, and now they've sort of relaxed them for people that are fully vaccinated. And just for clarification purposes, if you're to be fully vaccinated, means you've had both shots, if it was Moderna or Pfizer or the Johnson & Johnson vaccine, and you're at least 2 weeks out of that second shot or the shot of the Johnson & Johnson vaccine. I had to learn that. I thought I was going to be fully vaccinated after I got that second shot. They were like, no, you still got 2 more weeks. But be that as it may, the CDC has recently said that fully vaccinated people don't have to wear masks in restaurants and all these things. And so now there's kind of a stir being brought up because some places are still requiring people to wear masks. So what kind of clarification do you think that's caused more confusion or clarity with regards to the benefits of being fully vaccinated? Dr. Brooks?
So I think it has caused more confusion. I know it has caused more confusion. Whether they're right or wrong, which is debatable, it has caused confusion. I will say, to their credit, they cited an Israeli study that showed 86% of people that are fully vaccinated are unlikely to get asymptomatic disease. So the concern was people can be fully vaccinated but have asymptomatic disease and still spread it. 95% no COVID. So there was some science behind what they did, but it's hard to go from wearing a mask everywhere in your car by yourself, some people, to not wearing a mask indoors at a restaurant with a bunch of other people that you don't know. So we'll have to figure it out.
Dr. Clark?
Yeah, so I say that the CDC is perfectly sound on the science behind the spread of the virus, but there's something lacking in the science behind human behavior and how people think about this. So I think, unfortunately, if the idea was to get more people being excited about getting vaccinated, I'm not sure that the people who are unvaccinated will see this as enough motivation to go out and get vaccinated. I think they'll just see it as a motivation to take off their masks. Not to mention the confusion that these are just recommendations, and it clearly says in the recommendations that this does not supersede federal, state, and local law, OSHA mandates, workplace guidelines. And then the other caveat too is that you have to also continue to wear your mask if you are immune compromised, meaning you might not, if you're on medications or your immune system is not able to mount a vigorous response in response to the vaccine. So it's safest for you to consult with your doctor about continuing to wear a mask, as well as in certain places like hospitals or nursing homes where you might be encountering people who are have a low immune system. You have to continue to protect them. So public health is all about messaging, and I think that the fine print is going to get lost in the excitement about, oh, I could take my mask off now.
Yeah, I think you're absolutely right on that in terms of the messaging, because we get the devil's in the details, right? And so we say, oh, you don't have to, but then you've got state, local, and private business mandates that you still have to adhere to. And so a good rule of thumb I would suggest is that you bring your mask with you, have it in your purse, have it in your back pocket. If you feel comfortable and the establishment that you're going into allows it, then you could take it off. If not, then I would say continue to wear it, particularly if you're going to travel at airports, airplanes.
Oh, yeah.
If you're going to travel, make sure you have your mask on. The good news is that those relaxation of the mandates, the recommendations suggest that we're trending in the right direction. Would you agree with that, Dr. Brooks?
Oh, absolutely. I just looked at the recent statistics at the Kaiser Family Foundation website. 59% of Blacks say that they have been vaccinated. And those that are waiting, say, I'll wait and see, that number is dropping precipitously. So we are getting more vaccinations into our community. And I think it feeds upon itself. It's a positive feedback loop. When you see your cousin, your neighbor, and your colleague at work getting vaccinated, it just tends to nudge you in that particular direction. So it's key for the only way we're going to get to the other side of this is through vaccinating. I was on a call today where they stated the other way you get to community or herd immunity is through everyone getting infected and a lot of people dying. And the estimation is to get the herd immunity in that way, you'd have 1.7 million deaths. So we're at about 550 to 600. So you need another million people to die to get the herd immunity without a vaccine.
Wow.
And we definitely don't want to see that.
No.
Which is why that the allow it to just run through the population is just not feasible. And the other thing, to piggyback on what Dr. Brooks was saying in terms of moving in the right direction, what we're seeing is the states that have the highest percent of their population vaccinated are experiencing the highest drops in the number of new cases. So places like New Hampshire, Vermont, Connecticut, where over 50% of the population is vaccinated, we're seeing an 80% drop in cases. And even places, many of the southern states are lagging, but places like Mississippi, which is kind of in last place, 25% of the population is vaccinated. They still even have a 30% drop in new cases. So it's heading in the right direction. We just need to get there a little faster, I think.
Okay, so those people that they're still, obviously some people still on the fence. So we're going to kind of tackle the big headline issues. Dr. Brooks, can you please explain to people that might not have a full grasp on it, What is mRNA technology, and what is included in that vaccine?
Okay, so mRNA technology is a new platform for mass vaccinating, but it's been around since 2011, so for a decade. And basically what it is, messenger RNA in your body codes for proteins. It's just a blueprint to make a protein. It's just really that simple. The vaccine has an mRNA that codes for making what's called the spike protein, which stimulates an immune response. So you inject it, your body makes this protein, your body develops antibodies and an immune response against this protein. This protein is sitting on this ball, that spike coming out. That's that protein. And the antibodies in the immune system attack it when it comes in on that virus. And that way you don't get sick. And it works. 100% effective against death. So it's a very great technology. I think that people need to realize how great that is. The other vaccine, the J&J or Janssen vaccine, they just sit that protein itself on the top of an inert virus, and the body then comes in and makes antibodies to that, and those antibodies match sites on that coronavirus. So that's two different ways of getting to the same end point, which is having antibodies against coronavirus. They're both platforms are very effective.
Okay, so Dr. Clark, that's a great explanation. But what about those people that say, well, if the survival rate of getting COVID is so high, why don't I just go through COVID, create my own antibodies, and I can build my own personal vaccination by just going through the receiving COVID? What do you say to those folks?
Sure, many people have done that already. But unfortunately, what happens is a couple of things. When you have COVID, you are possibly in that group of people, and we don't know what makes people go on to develop long haul COVID. So when you get vaccinated, you don't actually get COVID. You get an immune response, and that you might experience that immune response as fevers and chills and body aches and headache and fatigue. It lasts no more than 48 hours or so, and it's gone. If you actually get COVID, you're sick for over a week. You may develop the long haul symptoms, and nobody wants that. Secondly, the natural immunity that you get from COVID is not as powerful as the immunity that you get from vaccination. So what we see is that people can get reinfected with the variants that are out there. Now, does that happen if you get vaccinated? Sure, it does, but at a much lower rate. And the additional protection you have from the vaccine, as Dr. Brooks said, keeps you from dying and oftentimes keeps you out of the hospital from getting any severe COVID. So those are the personal advantages of getting vaccinated. The community advantages of getting vaccinated have to be stressed, because when you get vaccinated, what we're seeing is it's less likely that you will pass it on to somebody else versus if you get the disease COVID. And so you have to also consider your loved ones, your coworkers, your friends, the people that you are around and interacting with. I know nobody wants to have that burden of guilt on them that they were the typhoid Mary, so to speak, who infected those people who they love. And so that's yet another reason, aside from the personal, to get vaccinated is for your family and your community.
So Dr. Brooks, I saw that the Pfizer vaccine has been approved for usage down to the age of 12, but before it was up to the age of 16. Now they've got approval down to the age of 12. What effect, if any, do you think that this will have on getting more people vaccinated as we move forward into the summer months?
So more people will get vaccinated just because you have more people that are eligible to be vaccinated. How many more, what percentage, we will see. There was a study where they surveyed the attitudes of Black parents. And Black parents did have a higher reluctance about getting the vaccine. And the thing that concerned me about it is that those parents were more concerned about the vaccine than they were the disease. And that is a little concerning. That being stated, there are a couple of things to look at. Children 12 to 15 generally don't get hospitalized, generally don't die. They can get that MIS-C syndrome, generally 2 to 6 weeks after their infection clears, which is very serious, a multi-system inflammatory syndrome in children, and higher rates of that in Black children and Latino. 50% of the cases of MIS are in Black and Latino. So here we again get to our people. You have something that will protect you from something. You're at higher risk of having complications and you're fighting the vaccine. I would say that the other important aspect of it is that children, even though they may not necessarily get sick, the studies out of Korea and more current studies, I believe, also showed that children from 10 to 19 spread the disease, spread SARS-CoV-2 virus. Children 0 to 9 generally don't. But these older kids, 12 to 15, that are getting vaccinated, if you get them vaccinated, the rates of COVID are going to drop even lower. So it is clearly a positive thing, and the vaccine is safe and effective. So don't forget that for all those that are vaccine hesitant, worry about their kids having their ear fall off or losing the ability to sing the national anthem. None of that's going to happen if you get the vaccine, okay? So I think it's important to understand that the vaccine is safe and effective. And lastly, the immune response is highest in children. The immune response in the children in the study was 1.7 times higher than that of an adult, which is a lot. So children have a robust immune system. Your highest response to vaccines is at age 9, and after that, it's all downhill. So feel very comfortable that your children can get vaccinated. They will mount a robust immune response. They will stop it from spreading. They won't get it. And they're just, and then the community aspect with which Dr. Clark referenced is also very important, to get closer to community or herd immunity.
I like to just to also add that I love those statistics that Dr. Brooks talked about in terms of kids mounting a more robust immune response. And that's often what I hear adults say, well, I exercise, I'm healthy. Why do I need to take the vaccine? I'm taking my supplements and my elderberry and my echinacea, and I'm good.
Right.
The thing is, when you get vaccinated, it's like somebody came to you the night before you were going to have a pop quiz and gave you all the answers. So it doesn't matter how smart you are. Anytime you have the specific answers to what's going to be on the test the next day, you're going to come out ahead. You're going to come out on top. So again, it doesn't matter how healthy you are. What the vaccine does is it tells your body exactly how to respond to the coronavirus. It gives it the heads up, so to speak, what the coronavirus looks like, so it can be immediately recognized and neutralized. And so again, for children and the parents making the decision about vaccinating their children and for themselves, please keep that in mind.
Well, it's interesting. We're talking about children. Is that some of the pushback and some of the people that have been hesitant are the ones that want to have children, and they feel like this vaccine might prevent them. There's been some stories floating around about it causing infertility or stillborn, all kind of stuff. And so just want to kind of put that, Dr. Clark, does the vaccine cause any infertility, any kind of problems with having children? If you're pregnant, any of those things, does the vaccine impact that system at all?
Yeah. We have not seen any evidence of that to date. And, people are concerned. There's been unopposed social media about vaccines being bad for you for years now, and it's just been amplified with the COVID vaccine. And I take everybody's concerns seriously, but there's been absolutely no evidence to date that the vaccine affects fertility. There were women, over 20 women in the study who got pregnant after getting vaccinated with the Pfizer or Moderna vaccine. There have been over 35,000 women reported in the database that looks at these issues around miscarriages, preterm labor, high blood pressure during pregnancy, all those kinds of complications, miscarriages. And there have been absolutely no change in the numbers between people who are vaccinated and people who aren't vaccinated in terms of these kinds of occurrences. So we absolutely have no evidence to believe that it affects fertility. It definitely doesn't affect your DNA, because the messenger RNA doesn't even get into the compartment where your own personal DNA lives in your cell. Plus, as I say, it's like Mission Impossible, where the tape self-destructs after a few minutes. Once this vaccination material gets into your body, it only survives for minutes to hours. And so, again, the possibility that it would affect your eggs or your sperm and cause infertility is next to nothing.
Well, great. Dr. Brooks, I know we got to let you go, but do you have any final words to kind of help people that are hesitant, that are on the fence, just to say, what are the positives? What are the things that they can do? Because I think that's been the biggest thing is, okay, I get vaccinated, but I'm still wearing a mask. I still got to wash my hands. I still got to wash my distances. And I'm not getting anything other than peace of mind, which is great for being vaccinated. What do you say to those people?
Well, first of all, by getting vaccinated, you are putting an end, slowly but surely, putting nails in the coffin of this particular pandemic. And if we're talking about African Americans, we have been hurting from this pandemic disproportionately. So you're helping your people. Number two, more on a practical level, that's the community aspect. On an individual aspect, you can be outside. I feel very comfortable being outside without a mask. There are some studies that show the drop-off rate is like 1,000 because it dissipates outside. If you're unvaccinated, all bets are off. So you can be outside, and come June, California is going to open up June 15th. And that guidance about being indoors, there is some truth to that. So you can, if you're fully vaccinated, you can feel a degree of liberation. Don't forget, this is a deadly virus. I mean, don't take it lightly. In other words, have more respect for the virus than worry about the vaccine. I'm sorry. And lastly, 100 million, Dr. Clark probably knows, more than 100 million doses have been given in this country.
Yeah, 270 million.
Thank you. So 270 million. You think if there was something like, I saw something about affecting puberty. I don't believe there's no studies in the 12 to 15-year-olds that didn't show up. So if you think that after 270 million doses, we don't know. I mean, J&J was on the market for 2 weeks when we figured out they were blood clots. So 7.9 million doses. So we're on this like a hawk. You can feel comfortable that this vaccine is safe and effective. And the more people vaccinated, especially you Black people, the more protection to our community, our families, and your own self.
All right, Dr. Clark, we'll give you the last word.
I've talked to probably 100 community groups about the vaccine, literally since January. And, a lot of people have changed their minds when they really look at the science, when they really understand that there has been disinformation pumped into our community intentionally, when they understand that I saw the comedian Michael Che from Saturday Night Live talking about why he took the vaccine. He said, well, there's a lot of people richer than me that were fighting to get it. So I figured it was okay. So there's been a lot of people coming into the Black community who don't normally come in, who have, especially when vaccine supplies were low, coming in to basically take the shots that were intended for us. And so if you're still scared after all that, talk to your doctor, talk to trusted people in your life who have access to that information and can help you think through what your specific concerns are about the vaccine. There's a ton of information on blackdoctors.org. There's a ton of information at Black Coalition Against COVID and in your local and state health departments to help you get to the facts that you need. So please consider taking that vaccine so that we can end this pandemic.
All right. Well, thank you so much. Dr. Clark, I'm going to ask you to hang around just a little bit so we can answer some questions at the end of the program. Dr. Brooks, I know you have to go. Thank you for being gracious with your time with us this evening. Thank you both.
Thank you very much. Thank you, Dr. Clark. Thank you, Ellis.
All right.
Okay. Great. All right. So now we just talked to some doctors. So the next person we're going to talk to Dr. Martha Dawson. And Dr. Martha Dawson is the president of the National Black Nurses Association. So she knows the pulse of nurses all across the nation. She's the head of nurses, Black nurses all across the nation. And so welcome, Dr. Dawson. And my first question for you is, what are you hearing from your constituency with regards to the vaccine acceptance and access for Black and brown communities?
Okay, let me answer your first question, and that is what are we seeing in terms of people getting vaccinated? And one of the things that we started early on was trying to educate our population. And so depending again, on the state that you're looking at, we're seeing different things. You know, in some states, we're seeing where people are ready to step up and they're stepping out to get the vaccination. However, when we look across all states, we know that African Americans are still receiving the vaccine less than our white counterparts. So again, I know one of the earlier speakers was talking about the Kaiser Foundation website. When I go to that website and I look at least about 42 states, about 40% of whites have been vaccinated versus 27% of African Americans. So that's about a 1 to 5 ratio there. And we know from history during this pandemic that African Americans have died more than whites. And so why is this important for us? Is because number one, we know there's been a lot of misinformation and disinformation out there. And this is what really caught my eye, is some of the people that were putting out the disinformation, they have already stepped up and taken their vaccine. Okay. So they and their family have been vaccinated. So my thing is, if this wasn't going to work, why did they jump in the line? And again, when it comes to actually making the vaccine available, yes, there again has been inequities. And those inequities showed up in terms of, let's say, I've heard stories, and some of these have been validated, so they're not distruth, but they are factual. You know, a state might have started their vaccination, and when they started the distribution, after they left those healthcare workers and those elderly population that was in the nursing home, and decided it was time for the general public to begin being vaccinated, there was information and evidence that, well, if you went to a majority site, you might have had 1,000 vaccines that was distributed. And then you went over into an African American community where they was opening a site, and you might have only had 100 vaccines there for vaccination. So those type of things automatically, again, begin to build distrust. So why my nurses and my constituencies and colleagues have been out there working as the part of the National Black Nursing Association, what happens is we've educated. We're ready to vaccinate. And all of a sudden we're at the site and there's no vaccine. Then now you got to try to convince your population all over again that this is the right thing to do. So trust is so important. And along with trust, you have to have a relationship with your community. And so my hat is off to all of the 108 chapters in 34 states plus DC, where the nurses have been out in the community prior to COVID. And we're still out there during COVID. Last week, I had an opportunity to talk to some nurses at the VA Medical Center in Birmingham. And I heard you when you came on that you said you was in the Birmingham, and I believe it was the Atlanta and the Charlotte market yesterday. So thank you for being out there, helping us to get the word and the message out there. That is just so important. So yes, there's been some discrepancies, but guess what? We're moving forward, and we're going to continue to talk to faith-based organizations, talk to nurses. We're going to continue to talk to those individuals in nursing home. And recently, I had two really important groups that I was excited that was reaching out to me that I spoke to, and that was the Mama Nation, and that is the group of female athletes. And so I had a conversation with them. I had about 305 individuals on. And then I also had an opportunity to speak to one of the unions for actors, explaining the need, you know, if you're ready to get back to your craft and you want these theaters and these movies opened, then guess what? You really need to be vaccinated if you are an actor. If you're in that space, there's no way you can do your craft without being almost up in someone else's face. So we need for them, if the rest of the public, if they want to see a movie or they want to go to a play, guess what? We can't do that if they don't step up, lean in, and help us reach that level of herd immunity that we need to have.
Yeah, I think it's important to stress, especially with Black populations being disproportionately frontline workers that have the most vulnerability, and that we also are a population that has a lot of comorbid conditions like high blood pressure, diabetes, that have COPD, that have shown to be the more deadly affected when you catch COVID. And so that's why we have a disproportionate death rate when it comes to catching COVID. Nurses in particular are frontline workers. And so when they're in the hospitals, when people are coming in with COVID symptoms, they're putting themselves on that in that front line to take care for people. What are you hearing from your nurses with regards to people that are coming in with COVID, and how deadly or how dangerous is this actually getting COVID on the system, on the body?
Well, COVID is, as we know, just about the number of deaths that we've had in this country. It's a serious public health crisis. And that's one of the things I want to make very clear to individuals. And that's why we're trying to approach this with public health interventions. Okay. Most people want to focus on after you get COVID, then you're in the hospital and you're sick. I want several takeaways from tonight's conversation. Number one, as I just said, it is a public health crisis. Once you get COVID and you're sick, that's not much we can do for you except for treat the problems that COVID is now causing in your body.
Right.
Which means it's multiplying, because all of a sudden, guess what? The COVID virus is very happy now. It's into a live organism. It can continue to multiply and survive while it's wreaking havoc on your body.
Mm-hmm.
And people have to also realize, and thank goodness, CDC has finally removed this, and you don't hear it in the news anymore. No one has recovered from COVID. Okay?
Mm-hmm.
Everyone who had COVID now has a pre-existing condition. They have COVID. Okay?
Wow.
And so anytime other medical issues come up, I promise you, once you present to a physician, whether it's in the emergency room or your primary care physician, they're going to want to know, did you have COVID? And if so, they're going to start looking and saying, is the complaint that you have today, is there any possibility that it may be connected to you having COVID? Did you have these systems prior to when you caught COVID? You answer no, they're going to check that possibility is due to COVID now. After they get down to 10 or 15 or 20 things and you keep saying no, it's going to almost say, yes, that may be a possibility that this is due to COVID. The possibility is going to increase. The next thing I want people to understand as well is that the reason we're talking about receiving the vaccination, because we are trying to protect you so that if the virus, you catch the virus, then you have strong enough immune system to probably fight that virus and not end up in the hospital, or not have all of those other symptoms and conditions that COVID causes, which is very important. And the third takeaway that I want people to understand is that, yes, we're opening up states. Everyone is excited about saying, well, if you had the vaccination, now you don't have to wear the mask. You can be out in public. I know that we're in a virtual environment, but if I was passing you on the street, I can't tell whether you had your vaccine or not. I'm sorry. I mean, so if I decide all of a sudden that I'm going to Walmart and Walmart said, you don't have to wear your mask, you don't have to do any of this stuff anymore, do you think I'm going to stand at Walmart and ask everyone, now, have you had your COVID shot before I go in? No, you're not going to do that. I know it may sound a little funny, but this is the true reality. We don't know who've been vaccinated and who have not been. We only know that at this point in time, there's a large percentage, but we're not where we need to be. Okay. And so, yes, with nurses, I'm hearing there's a few nurses that are reluctant to take the vaccine. But guess what? I can tell you the majority of the nurses that work at these academic medical centers, they're working at the VA, and they're working at these large teaching hospitals, most of them have had their vaccination because they were almost given no option.
Right.
And they was given no option on two things. One from the employer and the other one from the reality. Because guess what? If you're an academic medical center and you're the only one in your state or one of three in your state, when someone get COVID, guess where they're coming? They're going to fill up your beds first because you're an academic medical center. You are part of that scientific community as an academic medical center. But when all of the beds are filled at that academic medical center and they are beginning to run over, patients are going to then go to the smaller facilities. And those nurses need to protect themselves because guess what? Nothing against the nurses and nothing against the physician there. But they're not used to taking care of those critically ill patients the way our academic settings are. So the fact they may make one slip or one mishap, and the next thing they've contacted COVID from trying to take care of the patients. So what am I saying? My colleagues that are in the healthcare space, I want you to rely on your own science, your own reality, and protect yourself. If you're working in those big box stores, unless your employee just going to say, I'm going to fire you if you put on a mask or if you keep washing your hands, you continue to do that. Because guess what? About the hand washing piece, we should have been doing that anyway. We're already teaching the kids in kindergarten to wash your hands, when you go to the restroom, wash your hands before you eat. So this is just a clean habit that we all should have. Let's not make it all about COVID, but let's make it about good health, good practices, a healthy lifestyle, and more importantly for our African Americans, and it's expanded life expectancy. We already have very short life expectancy compared to whites, So we have too many of our young males that make it to 59 and make it to 60, but they never make it to 75, 80, or 90. We need to change those numbers. And we heard also about the health toll that mental health is taking on individuals during COVID. And this, again, includes the general population as well as the healthcare population. And that's why at the National Black Nursing Association, we've had something that's called Rethink and Reset that focus both on routine vaccination, but also focus on those individuals that are nurses and in the healthcare space and need to have some mental health support or mental health release. Because guess what? It gets tiring, and I appreciate that. Everyone is not an introvert. And I want to know people want to go back to the park. They want to go to the beaches. They want to have their family gathering. The 4th of July is around the corner. Somebody already started buying the ribs and all of that good stuff. That's great. But after the 4th of July, you want to be here for August the 4th as well.
Amen.
Okay? So you got to do what is right and what is best for you.
Well, I appreciate you, Dr. Dawson. I could talk to you all night. I want you to hang around if you can, because I know there's some questions. I saw some questions about how do we reach our rural communities. And so I know you have some thoughts about that, in particular, in terms of how to change the messaging and messengers that are going into our rural areas. And so stick around with us. And we got some other guests we're going to get to, and then we'll bring you back for the panel discussion, and we can answer some more of those questions.
Okay, thank you.
All right. Thanks, Dr. Dawson. Well, I'm sorry. If you can't go and hear that from Dr. Dawson, we've got some other guests that we're going to bring on. Right now, we're going to bring on Mr. Michael Lawson. And Mr. Lawson is the president and CEO of the Los Angeles Urban League. And welcome to the program tonight, Mr. Lawson.
Thanks for having me. Thank you very much.
So my first question to you is, how has the COVID vaccine been accepted by Black Americans in the Los Angeles area?
Thank you for this question. I mean, the Black community in Los Angeles has been responding to this in a way that's similar to what you've heard from the other speakers. There's a reluctance born out of a genuine, understandable mistrust of the medical industry.
Right.
It goes back a long way. And so I understand that. But the fact of the matter is, we have gotten past that, as evidenced by the fact that we have a significant portion of the medical community that is involved in this are Black and brown people. And I admire them, I love them, I respect them, and I want everybody in our community to do the same. When you hearken back to the Tuskegee experiment, those were not Black doctors lying to their Black patients. We can trust our Black scientists and doctors, and they're saying that this is something that we should do. They're saying that this is something that will protect us, and I believe it absolutely. So yes, it's we're not where we need to be, but the fact of the matter is it's getting better. The fact is that the Los Angeles Urban League was a co-sponsor of a vaccination site in Baldwin Hills, Crenshaw Plaza. And we had people in our community come to us and say, I am here because I trust the Los Angeles Urban League.
Right.
And I appreciated that. That warmed my heart to hear that. But we need more of that. We need more doctors who are on this program to speak out and speak in a way that gives our community the peace and understanding that they need from people that they can trust.
Right.
And so the more we do that, I think the better we would get. And people were coming to us, getting the vaccine, and promising to us without our asking that they were going to bring other people in. They're going to talk to their aunts, their uncles, their cousins, and say, no, this is okay. This is good. So come on in and do it. Over a 3-week period, we vaccinated over 15,000 people in our community.
Oh, wow. Oh, wow.
So we're very proud of what we're able to do.
Well, that was my next question. I was going to ask, what have the Urban League there in LA have been doing? What programs have y'all established to help people get over that distrust? Because they need a trusted source. And it seems like you're standing in the gap between the medical community, maybe state officials, state health officials, and the Black community. And you're saying, no, we trust these Black doctors that are on these panels, that are on these boards, trust them and to let them know that the vaccine is safe. And that seems to be an effective method for getting Los Angeles vaccinated.
It's all about respect and trust. And that's what we bring to the table. So we had the volunteers, we had Mothers in Action, taking taking down the information that was needed, and the questions were coming. Do you think it's safe? Yes, and it's just that communal understanding and trust that is going to get us over the hump. We're continuing to do that. Absolutely.
Great. So it seems like from what I'm hearing, if I'm hearing you correctly, that trust is the biggest obstacle, more so than what's in the vaccine and things like that. That's secondary, but it seems like just trust of the people that are bringing them the message, that are talking to them about the vaccine. They need to trust the messenger more before they'll trust the message.
They're tied together. They are tied together. Absolutely. Absolutely. So the Urban League this is our 100th year in Los Angeles.
Okay.
And so we are a trusted organization, and we've been that way for 100 years. And it's not just the organization, it's the staff that I have that working from dawn to dusk. And we know the people in our community, and they know us. And they trust us. And so, that is the message that has to go out. That has to be the relationship that we have. And we're going to continue to do that until everybody's vaccinated. Absolutely.
Well, that is wonderful. And I want to thank and applaud you for your efforts there in LA with the Urban League. Congratulations on your centennial celebration, Mr. Lawson. And hang around, because I know we've got some questions from the audience that we want to ask, and they may have some specific questions about what's going on in LA. And so we'll bring you back at the end of the program to ask those questions.
More than happy. Thank you for having me.
Thank you. Well, the next person that we'd like to bring up, we also have somebody else from LA. NoCal, don't get excited. Don't lose it. Don't lose it, NoCal. We've got some NoCal representatives here. But first up, we're going to talk to Dr. Mary Jkumar. I hope I'm saying that properly. He is a cardiovascular physician at Cedars-Sinai, and that's one of the more famous hospitals in the nation. If you know of any hospital in LA, you know of Cedars-Sinai. And so we're having him on to kind of talk about what he's seeing as a physician there in LA, and has he noticed any change, any differences with regards to from the beginning of the pandemic to now with regards to the Black community acceptance and access and awareness of the vaccines. You're on mute, so before you start talking.
Thanks for having me. How are you?
I'm doing great. So what are you seeing at Cedars-Sinai? Have you noticed any significant change? Have you noticed when you're out in the community there in LA, have you noticed any change with regards to Black communities' attitudes, access, acceptance of the vaccine, or do you still think we have a ways to go with regards to getting more Black Americans vaccinated?
I mean, I think we've certainly made strides. Do we have a ways to go? Absolutely. To say otherwise would be falsely, convey that this is over. And in no way are we near over. However, we're improving, and we have evidence of that from the patient census that we have in the hospital. When we talk about patient census, that means how many patients are filling beds in the hospital. And I have to say, I've been in the hospital day in, day out from the beginning of this pandemic. And it's been one of the hardest times of, my career. And I'm sure for every other physician that works in and outside of the hospital. And during that time, we saw waves of influx of patients coming in, and patients truly at their worst. And, the surrounding questions about how do we treat this, and what's going to happen in relation to this, and some of the answers that we didn't have then that, it's still hard to say that we fully have now. It's a full understanding that this is an evolving disease, and thankfully we have the equipment and the tools to be able to learn and quickly act and treat these patients. And so initially, we had waves of patients, and the hospital was completely full. And I'm happy to say that has exponentially decreased. At times there were literally no bed in the hospital that did not have a patient with COVID or that was suspected of having COVID. Now, specifically at our hospital, we have about 9 patients that are suspected to have COVID. I think about 6 are confirmed. And again, that's a huge decrease, obviously. And it makes us feel very happy. It makes us feel more secure. It makes us feel more comfortable when we have to go to work, as opposed to having to be masked up, gowned up, fully protected as much as possible, but still at risk when we were going to see patients. We feel more comfortable, particularly because we are vaccinated, but also for the patients that came into the hospital without COVID, right? If you have someone that's there, for my specialty specifically as a cardiologist, if I have a patient that had a heart attack and needs to be in the hospital, there was at one point where there were no beds for that patient. Wow. Right? You have a patient in the hospital who does not have COVID and was thankfully able to get a bed. Now they are at risk because they are around other patients that do, because of the capacity of the hospital. Obviously, the hospitals, we did everything that we could to try to make sure we limit cross exposure of patients and to have patients in isolated rooms. But as everyone is well aware, there was a max capacity that was breached in all hospitals. And so there were moments where you fear for the safety of patients who to their not of their own fault ended up in the hospital. and unfortunately maybe had to be next to or exposed to not only another patient, but a provider, such as myself, or a nurse, or a respiratory therapist, or an x-ray tech who just came from another patient's room who did have COVID. As we're trying to help these patients, now we have to go see you, and you're here for a urinary tract infection, but you're exposed. And so it's so encouraging, the fact that a lot of us are feeling more safe being in the hospital, and that the numbers have significantly decreased. And we're just concerned that it may go back up.
Well, you're bringing up an interesting point when we're talking about COVID and its impact on other illnesses, right? Because we're so far since the beginning of the pandemic, it's been so politicized and all over the headlines that we've kind of been trained to look at COVID in a vacuum or in a silo,
Correct.
and independent from other conditions. Have you noticed that your patients that probably should be coming in for screenings and exams in your practice or other practices aren't doing it because of COVID? They're staying home and they're missing, and they could be exacerbating conditions that are there that could be treated easily, but they're not going in to get seen by physicians.
Your question is spot on, because that's 1,000% what happened. When you have certain specialties that deal with chronic illnesses, particularly like myself as a cardiologist, I don't have a patient that just comes and sees me when they have a cold. I don't have a patient that just comes and sees me for the moment they're sick. I have patients that are lifelong patients. These are patients that unfortunately have a condition. And when I'm speaking about the patients that have cardiovascular disease, we know that heart disease is the #1 killer in not only America, but the world, right? So everyone has a brother, cousin, sister, aunt, niece who has some form of either risk factor that leads to heart disease, or has heart disease themselves, right? And that's high blood pressure, that's diabetes, that's high cholesterol, that's having a sedentary lifestyle, that's being obese. There's someone in your life who has one of these risk factors, right? And so my job is to help these patients live their best life and prevent the development of heart disease, or if they already have heart disease, to prevent it from getting worse or having complications from it. And so to be able to do that, to be able to do my job and do it effectively, I need to be able to see my patients. I need to be able to interact with my patients. I need to be able to follow up with my patients. I need to be able to touch my patients so that I can know that I'm doing the right thing for them, and that our plan, the plan that we've developed together, is actually being brought into fruition and working effectively. But if I can't have my patient come to the clinic, #1, if I can't have them come in because there's no space, because of the mandates that we have to limit the amount of people in our clinic. So now we have to reduce the number of appointments that we're able to offer. If I have staff that gets sick with COVID or has to call out because they were exposed by someone, now there's less people to be able to help process the patients so that I can see them. If I were to get sick myself because I were exposed to COVID from being in the hospital and caring for active COVID patients, then these patients are not able to come to the clinic, right? Or of course, if the patients were to get COVID themselves. So now they're conditioned that I'm supposed to be seeing on a frequent basis to help reduce the amount of medications that they have to be on, to reduce the reduced life expectancy that they may have because of these conditions, to reduce the quality of life that, or the poor quality of life that they may have before because of these conditions. If I can't see these patients, then I can't do my job in prevention and preventing the cardiovascular disease that is killing everyone. It's killing everyone, right? Not just in this country, but around the world. But in this country specifically, it's killing Black people, right? So my job is to try to stop that. And it's hard to do that. It was extremely hard to do that because of COVID and the limitations that it brought. And there were patients that were just straight up afraid to come to the hospital. They were afraid to come to the clinic. There were patients that we saw an increase in the amount of heart attacks that people suffered at home. Not the amount of people that came to the hospital with heart attacks. They suffered these at home, yet they did not want to come to the hospital because they were afraid of getting COVID, right? And we saw people with heart failure that did not want to come to the hospital, so they suffered in silence.
Yeah, you're making an excellent point with regards about that, because we at home, remember, the gyms were closed. People were afraid to go outside, so they're not getting exercise. They're just sitting at home, eating, trying to fill up that void at that time. And cardiovascular issues can really kind of manifest during that time and really exacerbate when you're just having a sedentary life. And so I know people have talked about that COVID-15. I know it's COVID-19, but that COVID 15 pounds that people have been sitting at home, we got to work that off. I know I grabbed a couple extra myself sitting at home. So I got to make sure that we're doing the right things in terms of our other conditions, and that we've got to monitor our overall health and not just have COVID paralyze us. And that's why we're really, another reason why we're saying, get the information, get vaccinated, so we can eliminate COVID off of that spectrum, so you can go back to getting your other parts of your health treated and taken care of. So, man.
And even with that, as you know, I mentioned all the cardiovascular diseases that I see and that I, previously saw prior to COVID. As the doctors mentioned before, getting COVID does not do you any favors as far as trying to get it the natural way and protect yourself, because part of the many patients that I've now seen during the COVID era have been patients who have long COVID, and people don't talk enough about long COVID and the complications that come from that. I have patients that are completely debilitated because they have palpitations, that's consistent heart fluttering and pounding in your chest, because of the tachycardia that comes with after being infected. And some people have mild symptoms, some people have severe symptoms, and some people are just scared because they now don't know how long this is going to last. And unfortunately, as we all know, COVID is new. So we don't truly know whether the therapies that we long treated some of these conditions with will still be as effective in the post-COVID population. So it's so important to realize that you don't want to get COVID. You don't want to get the immunity this natural way. And if you were to survive, think about all the things that come afterwards. Again, unfortunately, I had to work day to day in the hospital. I've been in the room with patients as they had their last breath. I've been in the room with patients as their heart beat for the last time because they were sick with COVID. These are young patients, old patients, patients that some may have expected to pass, patients that some had no clue would succumb to something like this. And so COVID is not choosy, it's for everyone, right? So it needs to be something that we truly want to prevent. And as things are getting better, the way that we increase that, the way that we make this happen faster, again, especially in our community, is by making sure that we protect ourselves. I love the analogy the doctor used earlier about COVID being the cheat code. No matter how healthy you think you are already, it's always better when you walk in with a little bit more support than you had before. And so that's what this vaccine does. And I would love to make sure that our community does not continue to be the one that continues to suffer the most.
Absolutely. Absolutely. Well, stick around for me, Doc, and we're going to have you back on, because I know there's some questions about asking more about that long COVID, that long hauler syndrome. And you're absolutely right. We definitely need to address that more, because I think people are more afraid of the possible long-term effects of the vaccine, but they're not really thinking about what could be more long-term effects of having COVID. They think if they survive that they're good, and that's not necessarily the truth. And I've been reading some studies here recently that says that COVID initially was thought to be a respiratory illness, but now it's a vascular illness. And so when you're talking about vascular, and that's right in your alley, so you could talk to it better than I can. So
Absolutely.
There is some long-term conditions that could be really affected if you've had COVID even. And yes, there was a question earlier said when Dr. Dawson said you have to list COVID as a pre-existing condition. Yes, you will. It's not gone if you've had it. So stick around for me. We're going to bring in some other folks here. So part of the discussion when we were building this program is that we just didn't want to have doctor come and talk to you. We wanted to talk to some people that have been vaccinated, some people that are out there working, whether in the school system and in the space, and talk about their experiences, not only with the vaccine, but what they're seeing as an everyday citizen. So we've got Jumi Oluko here with us. She is from the LA area. And then we've got Dr. and Mrs. Nicholas Baham. They're in Northern California. So Northern California, we got you. We got you folks right here. San Fran in the house. Oakland, all the
Oaktown.
represent Alameda County.
That's right. That's
We got
what's
the
up.
representation.
So I'm gonna ask this question, just to all of you all, and what are you seeing in the Black communities in your area with regards to vaccinations? What are your friends saying to you about the vaccine? What are conversations you having about the vaccine? Is it different than what we're hearing in terms of these national programs? Are y'all having different conversations in the community and with your friends than what you're seeing on the television? Jumi, we'll start with you.
Yeah, I think Mr. Lawson hit the nail on the head for sure when he said that there is reluctancy in the community when it comes to the vaccine. I have friends here who have yet to get it, and I've heard things from, I'll just let the COVID antibodies, ride out with that, or I'll just, continue to play it out until I absolutely need to. So there are some people that are just still really not trying to get it, and whether that's from, what's happened in the past, or the fact that probably my stories about how I felt after I got the shot probably weren't too helpful, but there is definitely some hesitancy.
Angela?
Yeah, I would say that there is hesitancy as well. While I was listening to the rest of the conversation, I took a little survey of all my friends and just came up with actually, I was surprised. 70% of my inner circle has received the vaccine, but 30% still have not, right? And I think that, it's definitely just like people are just feeling a little distrustful. Some people are citing, the history and the system and not, trusting the healthcare system. But other people have more personal reasons than that. For example, we have a friend who generally doesn't take anything. I mean, he feels like he manages his own healthcare because when he was a kid, he was on a lot of meds and just decided personally he doesn't do meds. So that's how he's rolling with it.
Yeah. Nicholas?
Well, in my capacity as a professor at Cal State East Bay, I served as an example for my students of taking the vaccine. So I took the vaccine, I put that out on social media. My students have followed suit. I have mostly younger people, although there are some senior citizens that I teach, and the sort of response within that setting is pretty good to the vaccine. Additionally, the Cal State system, which is the largest university system actually in the country with 23 campuses, is initiating vaccination centers on every campus. Okay. And that is now a requirement for coming back to class in the fall. So we're getting it done in that sense. But I would say that there is obviously in our broader communities in which we exist, some vaccination hesitancy, a lot of which Angela just articulated. My problem really with this has been, well, let me mention my problem and the one real great bright spot here. Let me start with the bright spot. The bright spot is that we are seeing activist church organizations who are vaccinating people en masse. And Angela can give you the numbers for example, Allen Temple, but it is extraordinary. And we are, we're talking about East Oakland, working class, Black, Latinx. There are people around the block for the vaccinations. Now, the downside is that organizations like Allen Temple or Acts Full Gospel in East Oakland, while they started vaccinating via Pfizer, all of a sudden Pfizer got pulled.
Oh, wow.
And it became J&J. There is a perception with some of the folks that I've talked with in the community that we're not good enough for the Pfizer.
Well, I do want to
high number vaccine, and that is problematic. But I do see benefits to just getting the one shot, because apparently there are people who are not going back for that second shot.
Right. Angela, you had something you want to add to that?
Yeah, I wanted to update with that. That was quite a few weeks ago now, and Allen Temple is now offering all 3 vaccinations on different days. We vaccinate 3 days a week, and we also have walk-in testing as well as by appointment if that works for you. So that has been cleared, and we have Pfizer on one day, we have Moderna, and we also have J&J. But Nick is absolutely right that there was a lot of, hullabaloo around the whole thing. And then there was a big to-do when they opened up a large vaccination site at the Oakland Coliseum. And on literally the very first day, by the evening news, there was reports that they had given out the wrong dose. The wrong amount to thousands of people. And it was the first day that they had the site open. So that was a big hiccup in the whole process. But there is also a website, blackchurches.org, where you can go and you can find Black churches that are offering the vaccine, that you can go and sign up and make an appointment or just do a walk-up, and it's available for folks. So availability is a key issue for our community for sure. And then just kind of being the workaround in terms of convincing people that they can trust this process, that your church, your pastor, your friends and neighbors are not just trying to dupe you. I think that's really important for people to understand too. There's just kind of a lot of suspicion and conspiracy theories rolling around about, they just want us to get vaccinated, and the vaccine kills, all kinds of things that are out there that you hear.
Right.
So,
So that was blackchurches.org?
Yes.
That's the site? Okay, I want to make sure I got that right, because I'm going to put it here on the screen, and I want to make sure I got the right. So that's exciting. So if you're not comfortable, and that's wonderful. I'm glad we had y'all on to talk about those type of information, because we do need to know that. Where can people go if they're not comfortable going to a pharmacy or a medical center? If you want to go to your church, go to blackchurches.org, find a church that you can go and get vaccinated where you feel more comfortable, where there's people that you can have some real conversations with. Got to know that's kind of been some of the challenges we've had. Jumi, you mentioned your experience with the vaccine. What was it like for you?
Well, so for me personally, the first shot was, when they first hit me in the arm, I was like, oh, that's it. I'm good. Okay. So this is fine. And then it hit me a few hours later. It was a little numb, I couldn't really lift my arm too much. And so that wasn't exciting. And it didn't make me look forward to the second shot. I'll be real. Like, I was just like, I could probably do without this second shot, especially with all the different things that people were saying about it. And then I got the second shot, and same thing, like it felt perfectly fine being pinched with the needle. And then 100% transparency, I got body aches, and they were bad. Okay. I got very bad body aches. I had never felt them before. I was just like, this is the devil. This is not fun at all. Right. This is not fun. And I told a few people that. And I told a few people that have not gotten vaccinated, or they got the first one. They're like, yeah, I'm good. I'm not going to get the second one. I don't want to experience that. And so it's probably not helpful. But now, I'm past the 2-week period of getting my second shot. And I feel great that, I've done it. The body aches didn't last. I didn't die. I'm still here. And I feel good that, I'm contributing to the fact that we're going to get past this moment. We're getting to a better place because of the vaccination, and because it's just something that we all need to do. Yes, we can all experience that discomfort for a little bit, but it won't last forever. So it wasn't fun for those, I guess that's a month period between the first shot and the second shot, but hey, I'm still here.
Nicholas, you want to describe your experience with the vaccine?
Yeah, for the first shot, for me, it was just a mild headache. I took a couple of Advil, I was fine. The second shot, I think it hit maybe 12 to 24 hours after I needed a nap, and, it was just a couple hours, I was good. I'm noticing though, and this is purely anecdotal, but I would I would like for you to ask this question to some of the doctors who are going to come back on, that some of my friends who are leading more sedentary lives and are maybe dealing with obesity, diabetes, etc., that the impact of the second shot was a lot tougher for them. Okay. It was hours. For a good friend of mine, it was actually days of flu-like symptoms.
Absolutely. Well, yeah, we'll talk about that. And I think what we mentioned earlier, and we'll ask when we bring the doctors back on, that second dose and what you're experiencing is your immune system kicking in, right? So the first dose is your body recognizing, okay, this is a foreign substance. You put it in there, then you go to the second one as a booster. Then your body really attacks your immune system because now it's recognized it. Your immune system turns on, and when your immune system turns on, that's when you have those kind of symptoms.
Oh, it turned on. It turned on because
Angela, what was your experience with the vaccine?
Yeah, actually, my whole process was really very easy. The church reached out, we got signed up, we got on early, we got in the line. They were playing gospel music, had the speakers out there. It was a very easy, simple process. I didn't have any symptoms. I didn't have any, need for a nap or any need for Advil. My arm didn't hurt too much. The second time, maybe I could only go this high, but other than that, my process was pretty easy. So
I think it's important to see how we had 3 different responses to the vaccine, and just to let people know that it's an individual, right? So my first shot, I couldn't barely lift my arm. It was super sore for 2 days, and I didn't take any medication because I wanted to see how long it was going to last, and so I didn't want to mask that. And then 2 days, and then by day 3, my arm was back to working. And then on the second shot, I was really bracing for Jumi's type response, and I didn't get it. I got the same sore arm. But I got that peace of mind with it, now that I've gotten fully vaccinated and I feel safer being around, my in-laws have conditions, parents. You do want to be able to go see your family and feel comfortable being around people. And so that's really the peace of mind that I've gotten. And now that I've gotten my 19-year-old daughter is vaccinated as well, because she's fit that. And now we're talking about getting our son vaccinated now that they've extended it down to 12 because he's 13. So that's the real. So we wanted to make sure that when we had this discussion tonight, we wanted to talk about not just the high medical facts. We want to talk about what we're going through personally and how people are really responding to it. So we're going to bring back Dr. Clark here, all of our guests to really kind of finish this discussion tonight. And I know we didn't ask if anybody else would like to share their vaccine experience, what it was like for you. Did you have a pronounced response, or was it just more sore arm, or did you have not a little response? And I would caution everybody just to go on mute, since we've got a lot of people on screen. Go on mute if you're not speaking. So Dr. Clark, let's start with you. Yeah, we'll start with you, Dr.
Sure,
Clark.
I'll be happy to share. So I actually got my second shot January 28th. My first shot New Year's Eve. And the first shot was fine, just the sore arm like you described for about 3 or 4 days. And then the second shot, I had the sore arm again, but I had, the whole constellation of aches and fatigue and headache and chills. And for probably exactly 24 hours, it lasted, and then it was gone. And just so that statistics wise, for the vaccines, Pfizer, Moderna, and J&J, for the most part, almost 70% of people had some kind of those symptoms. Around 70% had some kind of those symptoms. They were less often experienced in people 55 and older. And that's because as we get older, our immune system gets a little bit more sophisticated, a little chill. And so it doesn't react as aggressively as a young person's immune system. And so that's why you see a little less of those constellations of symptoms, and more often just the fatigue.
Well, I sounds like you just said I got an old body because
No, you have a sophisticated immune system.
I got a sophisticated.
You
Okay,
know,
I
like
appreciate
the grown and sexy kind of thing. Yeah.
I appreciate that, Mr. Lawson. I saw you raising your hand.
My testimony is real easy. I had no symptoms whatsoever.
Okay.
No pain in my arm when I got the shot. No issues whatsoever after I got the shot. It was clean and easy. I guess I'm in that 55 and older group. I don't know, but it was smooth.
We'll say you're part of that 30% that doesn't have, so we won't put an age on it. We'll just say 30% of the people don't experience those type of heavy symptoms. And so you're part of that 30%. And that's why I'm gonna put myself in that 30% as well. Dr. Dawson, there was a question earlier in the program about how can we reach rural communities? And so I wanted to specifically, because I know we've been on conference calls before and you've talked about that and the difference in terms of messaging, in terms of reaching rural communities versus metropolitan areas like LA or San Francisco or Atlanta. Can you talk to what that messaging has to be like to go in and reach rural communities and get them vaccinated?
I think, again, one of the first thing you have to do is find those trusted individuals within the community, whether that may be your small mayors that are in those rural areas, whether it's someone from a faith-based organization, if it's a school or a college, but again, it's have to be relationship-based. And I think, because I know in some states, they decided, well, when they got ready to go out into the rural area, they was going to call in the National Guards and they were sending them out there. And I'm going, bad decision. Okay. You're sending people in there with fatigue on. They got the combat boots and all these things. That's not a way to build confidence, because some people are saying it almost like you're going to force me to take it then if you're sending in the National Guards, I'm going to be forced to do this. So you have to think about the appearance. So what we've been doing as the Black nurses, again, is working with those physicians that we know have already been in the rural communities. So for example, I know in the Birmingham area, we have a physician, she and her husband have been for the last 18 years, rotating between about 5 to 6 rural communities that every second Saturday, they're in that community. Finally, CDC have just given them approval to be one of those individuals that can get the vaccine and go back into those communities. Oh, wow. So when they go into the community, people are going to recognize them. They've been going to these same communities for 18 years. So I would say to any of the states, find those individuals that already either are residing there or they've been going there already doing work. You don't want this to be a surprise attack. Like, I don't know who you are, you're here telling me to do something, and you bypass all of the trusted sources within that community. That just isn't going to work. And the other thing I would say again is reach out to those individuals, whether they are pharmacists or nurses. But as I stated earlier, we have 108 chapters. Even in the state of California, we have about 9 chapters out there. So we're out there in Oakland, and our nurses in Oakland, I know they was out there 1 week. Just that chapter gave out 1,000 vaccination because they're there. They're in LA, they're in Riverside, they're in Fresno. And the same thing if I go to Florida, we have nurses that have been working with the Urban League, working with the NAACP. So we're partnering with those individuals again that are in the community, and they've been doing this partnership for a long time. So again, it is individuals recognizing people that they feel comfortable with. And someone also, I'm sorry, I have to throw a plug in. Yes, I've had my vaccination, and I thought they didn't tell me this was going to be an age-related conversation tonight because I had no problems either. I'm the first, not the second. But I guess my nursing kicked in because the day before my first one, I started exercising and doing my little weights with my arms and everything. So I didn't feel anything. And I was really built up for the second one, thinking I'm going to be in bed. So I planned. I'm not going to schedule anything. I'm going to have it on Thursday. I'm not going to schedule anything. Not going to schedule anything for Friday. So I came home. I went for a walk. I was feeling so good. And I went to bed. I said, oh, it's going to hit me overnight. And I'm not going to be able to get it. The next morning, I just jumped up like the look, ever ready bunny, and kept going. And to be honest, I was looking for a rest day. And I did not get it. And I was saying, like, bring it on. I need to be in the bed. I'll be up by Sunday. That's good. It didn't happen. So again, every person is different. But I want people to really, truly understand that we really don't have another choice. This is, like I said earlier, there's not a treatment for this illness, and you don't want to get it. You know, as our physicians have clearly spoken, is that this is an early process with this disease. We don't understand all of the long-term effects. And the thing is that, you know, when people, I've spoken to nurses that contacted COVID, and they're not just complaining about tiredness, but some of the nurses that I've spoken to said it's like about every 8 to 12 weeks, they're having a rash to break out on their body. Mm-hmm. And each time it's spread, and each time is more painful than the next time. You know, there's been things about shortness of breath. And when you look at our young pediatric population now, again, some of those who had the disease early on, yes, they are going into the hospital with pulmonary and cardiovascular disease. So if I had to, I'm not a gambling person, but if I was going to gamble with this virus, I would go with the vaccine before I would go with catching the virus. Because at least the vaccine we know have been studied by scientists in terms of the reaction. We keep learning about what COVID is going to do to our bodies as we unfold this. And some people may say, so I'm a diabetic, I have hypertension, or I have X, Y, and Z disease. And I will tell you, I'm a diabetic, I have hypertension. A little bit overweight since I picked up my 15 pounds for COVID, but not truly overweight. I can still get into a size 6, okay? So I'm doing pretty good. But I just want people to understand that you just can't sit back and say certain things. I had a very good colleague that is not in the medical profession at all, but he's one of my colleagues at my university, and he has Parkinson's disease. And when I first started talking to them about needing to get vaccinated, yes, he had that hesitancy. And he was saying, I don't know whether I'm going to do it or not. Brought him on to do some town hall meetings with me. And the reason I did that it was because he had participated in clinical trials and it had nothing to do with COVID. So I wanted the public to hear that African Americans was participating in clinical trials even prior to COVID. And the second time he did the show with me after the first one, he said, I have to confess, I wasn't going to do this, but after keep listening to Dr. Dawson and she keeps saying we need to do it, he said, I finally just went ahead and I've had my vaccination. And he said he had no problems. So another colleague that have sickle cell disease. So we do have that track record now of people with some comorbidities that are taking the vaccine and they're not reporting adverse events.
Dr. Clark and Dr. Jkumar, I wanted to, there were some questions in the comments about talking more about the long hauler syndrome, and are there any kind of what we've known thus far? Because again, every day we're learning, right? Every day is a new experience. We don't know because it's a new disease. We've got some controls. So I guess the question really is more, why do you think people are so concerned about the long-term effects of the vaccine more than they're afraid of the long-term effects of being infected by COVID?
I think there are a couple of reasons for that. One has to do, I think, with just, as I mentioned before, the unopposed social media that has been inundating our communities for 5 years now. It started, and this is well documented by the University of Maryland Center for Health Equity, how the same Russian bots and trolls that influenced the 2016 election have been pumping information about misinformation and disinformation about vaccines into certain communities, targeting them, including the Black community. One of the first pieces of misinformation that I ever received was from my cousin in Jamaica on March 20th. I looked back and saw the text. And so, it took us as the medical community a while to mobilize to actually start counteracting that. But by then the seeds had been planted. And then conversely, we haven't been talking enough about long COVID, as other panelists have noted. Just this morning, I'm a medical contributor to the Russ Parr Morning Show. And so this morning I reported on one of the latest studies, which is that COVID, having had the disease, is associated with erectile dysfunction. I know that's very scary for some men, but if you think about it, the penis has blood vessels, and therefore it is just an area of the body that is vulnerable to inflammation of the blood vessels and less blood flow, just like any of the other areas of the body that have blood vessels. And we see blood clots, we see the heart complications, we see the kidney complications, we see the lung complications, we see strokes, we see heart attacks, all related to that lack of blood flow and inflammation. And so, we're not talking a lot about that. We need to talk more about that so people understand the true risk benefit analysis when you're deciding, should I take the vaccine or not?
Right. Dr. Mary J, do you have anything to add?
Yeah, I think, everything Dr. Clark said was correct. And, to piggyback off of it, we're also in the day and age where, COVID happened to happen during a historical presidential election, and everything was politicized this year. So, when you add the hype of social media, and then you add the politicalization of this vaccine, you put this in a situation where sides are going to be chosen. And unfortunately, the misinformation that's out there really caters to one side more than the other. I think that it's very important for us to, make acknowledgments about not only the benefits of the vaccine, but also verify and speak to some of the concerns that people have from the misinformation that they're hearing. So when they say things like, the concerns about pregnancy, let's talk about the facts about, what we know, and use our background, the background that we know prior to COVID, to say, why is that something that is not likely to happen in this situation? Same thing with heart disease and the other complications that we know come from this. Misinformation can be easily made up. And why it's hard to fight is because it's misinformation, right? So anyone can say whatever they want. And you almost seem like a fool when you're trying to explain the scientific reasoning behind something, because it's like, well, yeah, you're just going to say that, so there becomes this battle, and trying to fight misinformation is a hard thing. And so again, with the politics that have come from the past year, it's very hard to have a debate of any kind, because everyone, no matter what side you're on, is just going to say you're just saying that to appease your side, right? That's when it really just comes down to facts. And I think my job and the job of every physician and healthcare provider, and just advocate for health, is to inform. All we can do is provide you with the most up-to-date, the most accurate information to the best of our knowledge, and hope that we can do our job in supporting you in making a decision that's best for you and your health. And, particularly to the Black community, for those that decide that this is not something that they want to do, it is not something that they should be chastised for. We should not ridicule you or beat down individuals that make that decision. The same with my patients that decide that they're not going to take their statin, or they want to have their In-N-Out burger, no matter what their cholesterol is. I'm going to support what they want to do, yet I'm going to inform them about the risk that comes with that decision. And so with everything that we do, it's a risk and benefit analysis. And at some point, there's going to be risk that weighs more than the benefit, or vice versa. It's our job to be able to help you, scale that balance and hopefully make the right decision for you. But again, when there's so much misinformation and politicalization about something as integral as the vaccine, it's obvious that it's going to run rampant, especially in this day and age of social media.
Yeah, Dr. Bayham, I want to ask one last question to you. Is you said earlier that the university schools California system has now mandated vaccines to return to campus. Has there been any pushback from students, parents for that mandate?
Well, none that I've detected up here, but keep in mind that part of the issue is that we're not on campus right now.
Right.
So everything is, virtual. I'm not aware of any particular campaign that's been launched at our university or any adjacent universities in Northern California against vaccination. But keep in mind, because we're a 23 campus system, we do have campuses in relatively more conservative areas of the state. And I would not be surprised to see some pushback in that space as well. But again, California's been through a rather rocky road about all of this. If you remember, we were one of the first states that started with the lockdowns. We now have the recall election of a governor who instituted that, primarily because he instituted that.
Wow.
So I think, the thing is, you just got to roll with the politics and the misinformation on this and do the best that you can if you're in leadership to provide a healthy situation. And I will tell you that myself, in my mid-50s, personally, I won't return to campus until students are vaccinated. So part of the pressure that the California State University system is facing is also from faculty and from the union, who are communicating, we won't go back because you have no other way of making the classroom safe, right?
Right.
They're not going to invest in the kind of infrastructure within those classes that could allow possibly for students to be in there and not be vaccinated. I won't go back and I'm not alone in that.
Mr. Lawson, last question for you is, how much is COVID dominating what the Urban League is doing there in the Los Angeles area?
Oh, it's having a very serious impact. One of the things that we do is job training. Right. And now we have to do all that job training remotely. And you have to understand that most of our clients are living in areas where the access to Wi-Fi is not, it's not speedy. A lot of them don't have the computers. Some of them are homeless. Right. We're doing our best to provide people with computers and hotspots to the extent possible. But I praise my staff for doing a great job of providing a service that is close to what we were doing when we had in-office training, but it's not the same. And we don't have the same number of clients coming in because of a lot of them are essential workers. They come to us for training for better jobs and union positions and so on and so forth. So this is a drain on our community, a significant drain on our community. And don't get me started on the issues with respect to the education of our kids.
Oh, wow. Yeah.
Who are losing time and space, and they have to make up this time, and they only have, they're going to be catching up for the next 12 years. Mm. Yeah. And that's what we have to focus on, because this time has been lost. And we're working on getting college students to do tutoring as not a substitute for the teachers, but to supplement what the teachers are doing. So there's a lot more work that needs to be done. We've got 40% of our Black businesses have closed their doors. We have to rebuild that. As was said a long time ago, when America gets a cold, the Black community gets pneumonia. That's where we are. So we have a lot of work to do, but know this, that we are up to it, and we will continue to fight this fight.
All right. Last question of the night. We'll let y'all go. Jumi, you gonna be back out in them streets now when they open California back up? You go.
I will to an extent. I'll be nice and safe. I'm still gonna wear my mask because I don't trust people. And I think what has been said is like, you just don't know who's really vaccinated. What they've done is given everybody a yes, go ahead and take your mask off, even if you're not vaccinated. But I will be out there safely enjoying the LA summertime. Yes, indeed.
Well, and I think you bring up an interesting point as we close here, is that there is that desire, and we can't run away from that. There is the desire to get back to the life, to be able to go out, enjoy our lives. And it sounds like what we're saying here tonight is the best way to do that, the safest way to do that is to get vaccinated, right? That's the safest way to do that, to be able to have kids back in school so they don't get too far behind, and Lawson talking about, to have our communities safe for all of the people that are frontline workers that work in kitchens and baggage handlers and all the people that work in frontline handlers, to keep them safe. If you want to go in the club with Jumi and dance with your mask on, you could be able to do that if you got that vaccine in your body. So I think that's what we're really saying here. So I want to say thank you to everybody for joining us this evening. Dr. Dawson, the National Black Nurses Association, we appreciate your partnership. Mr. Lawson, thank you. We have had the national president of the Urban League on, and we now have the LA president on. Anything you need from us, reach out. You have my email address. Anything you need from us, we will be there to get you information. And if you need a specialist, we can get there. Dr. Clark, Monday night, 9 p.m., excuse me, doctor, you can catch it right here on blackdoctor.org to answer all of your questions. Dr. Jkumar, thank you so much for everything that you're doing at Cedars-Sinai. It's very impressive, and congratulations on your engagement. I saw your video that you produced, so congratulations on that. Dr. Baham, keep doing what you're doing, keep fighting the fight. Angela, thank you so much for being on here. Appreciate it. I need to put on blackchurches.org. Go check that out. If you're not comfortable going anywhere, go to blackchurches.org. Thank you for bringing us that information, Angela. And finally, Jumi, you can jump in with Jumi. She is also a host here on blackdoctor.org Thursday afternoons at 2 p.m. Pacific, 5 Eastern. So you can always check out her wonderful programming there. So I think I've covered everybody. Thank you all. I'll give you a virtual hug. Thank you for with us tonight. Thank you all for staying with us. Everybody that stayed with us the entire time, thank you for staying with us. Hopefully we got to your questions. If we didn't, we're going to do another one of these. We're going to keep doing it. Next up is Texas. So we're going to be doing Houston and Dallas. So if you're watching us from those areas, we're going to be back in Texas. So thank you so much, and you all have a good evening.
All right. You too. Thanks, fellas. All right.